Thank you so much, Madam Chair. AB 516 will clarify that registered veterinary technicians and veterinary assistants are able to perform any tasks they are not explicitly prohibited from undertaking by law. RVTs and veterinary assistants are versatile professionals supporting their supervisor veterinarians by performing a wide variety of critical animal care tasks. In fact, RVTs are allowed to perform any work duty that does not constitute diagnostic, prognostic, surgical, or prescriptive activity. However, current regulations are written in a way that obfuscates the true extent of RVT and veterinary assistants' responsibilities. They contain many exhaustive lists, which creates the misconception that the staff cannot perform any unlisted task. This, in turn, discourages veterinarians from entrusting their staff the full range of responsibilities they are trained and qualified to perform. Unfortunately, this dynamic exacerbates California's ongoing veterinary care shortage. In February 2023, the UC Davis Shelter Medicine Program published survey results that showed that 25% of California's animal shelters lacked adequate veterinary staffing, and 64% could not address basic medical needs. While unclear regulations do not necessarily cause or contribute to these staffing issues, they can impose artificial restrictions on those already working in the shelter space. When those staff go underutilized, shelter veterinarians find themselves burdened with additional work, which reduces their capacity to offer essential surgical, diagnostic, prognostic, and prescriptive services to shelters and community members. AB 516 addresses this issue by plainly stating that RVTs and veterinary assistants may perform any task that they are not otherwise prohibited from undertaking by law. It also affirms that RVTs are allowed to perform dental care procedures, including dental extractions, under the supervision of a veterinarian who is licensed or authorized to practice in the state of California. By making clear the extent of RVT and veterinary assistants' professional responsibilities, AB 516 will address regulatory opaqueness that it contributes to California's acute veterinary care shortage. With me to provide supporting testimony is Dr. Grant Miller, Director of Regulatory Affairs with the California Veterinary Medical Association.
Thank you. You have 2 minutes. Go ahead. Thanks for being here.
Good morning, Chairperson Ashby and members of the Business and Professions and Economic Development Committee. As Assemblymember Coward mentioned, my name is Dr. Grant Miller. I am the Director of Regulatory Affairs at the California Veterinary Medical Association. We are very pleased and thankful to work with the Assemblymember once again on co-sponsoring this important legislation along with the San Francisco SPCA and the San Diego Humane Society. AB 516 will assist California's veterinary practices and shelters by clarifying previously confusing patchwork quilt regulation and statutes pertaining to what registered veterinary technicians and veterinary assistants are able to do in practice. Unfortunately, there is a lot of confusion among various veterinary practices and practitioners throughout the state about what they can do. And it's difficult because they can do so much that we're not having them do. This bill will affirmatively clarify that unless otherwise prohibited by law, they are able to do important measures like, as Assemblymember Cowher mentioned, cleaning teeth, extracting teeth, administering vaccines, providing parasite control treatments, addressing wounds and skin problems, and other things that will improve access to veterinary care for California's pet-owning community. We greatly appreciate the state legislature's ongoing and dedicated attention to California animal shelters and veterinary practices, and respectfully ask for your aye vote on AB 516. I'm happy to answer any questions should you have them. Thank you.